Good afternoon, good evening. Thank you so much for joining us for the weekly briefing on health emergencies across the continent. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Today, we are joined by His Excellency Dr. Kaseya, the Director General of Africa CDC, who will be taking us through the situation analysis on the health emergencies on the continent. I will now hand it over to Dr. Kaseya to start the session. Over to you, DG.
Good morning, good afternoon, good evening to all of you. I'm glad to join you. The past 2 weeks, I was traveling and I didn't manage to join you. Thank you. Thank you to my colleague, Dr. Ngashi, and the comms team for the wonderful job they are doing to continue to update the world and the continent on what we are facing. Let us start with some slides, then we'll have some time to exchange. Please let us go with the presentation. Okay, we know the challenge we are facing currently in Africa, especially with the head cut that pushed us to take a number of actions, and we'll discuss that today. You will see today it's not just to talk about the outbreaks, but we'll talk about how Africa is taking the corrective measures to mitigate the impact of this head cut. I was 2 weeks ago in Canada and the US to discuss a number of issues, and I'm back in Addis today. I received my brother, Dr. Chikwe, who's leading the WHO Afro, and we discussed about how our two organizations can better support African countries. Tomorrow, I will be meeting and I will be hosting the President of Angola, who's the African Union chairperson in Africa CDC. It will be followed by the Prime Minister of Ethiopia to discuss the support of our leaders on the concrete actions that we are conducting for the continent. And the afternoon, I will have a meeting with all ministers of health in Africa to discuss how Africa can develop some mechanism to mitigate the impact of this head cut. Then, with this meeting, we are thinking to organize together with World Bank and IMF a roundtable in Washington during the spring meeting to discuss some sustainable financing mechanism for Africa. We'll go deeply on some of the issues during our discussion, but it was just to set the tone to tell you that Africa CDC is taking proactive actions, strong political and strategic actions to bring our countries together regarding this challenge that we are facing with the change of the global landscape. Next slide, please. If we need to talk about outbreaks, we know we are still facing the challenge regarding Mpox, but we have Marburg, Ebola, measles, and all other outbreaks. What is the very good news we want to share today? It's the end of a Marburg outbreak in Tanzania. We congratulate the government of Tanzania because it was tough, but on more collaborative and transparent way, we managed to together to stop this outbreak. We are celebrating that as we are celebrating the end of any other outbreak that the continent is facing. We believe that in a few weeks, we'll also celebrate the end of Ebola outbreak in Uganda, because since the last week, we didn't have new cases, and we believe that we can continue like that. Africa CDC is there. We'll discuss more information regarding Uganda later. My colleague, Dr. Ngashi, was yesterday in Angola for the handover of some doses of the cholera vaccine. And we are supporting Angola and all other countries like Namibia, as we'll see, who are facing the cholera outbreak. We also want to celebrate the success of vaccination of in DRC against Mpox with 400,000 people who completed the vaccination in Kinshasa. This is something amazing, but we'll see the challenge that we are facing in terms of possible shortage of vaccines, Mpox vaccines in Africa. Next slide. Regarding Mpox in Africa, we still have a number of cases. You will see the trend. We have more suspected cases, but less confirmed cases, as you can see in this figure. It's just because the testing rate is not what we are expecting, is too low. And when we talk about the testing rate, we talk first about how we are collecting the samples, how we are transporting the samples, and the capacity to test. We know with the head cut and also with the insecurity, we are not doing very well in terms of collecting and transporting samples. I think this one is a major alert for us. We wanted to share that with the world and to say we still have a lot of concern. If we don't test all cases, we are exposing our continent and even beyond the continent to a major outbreak. And as you know, in the next slide, you will see, next slide, please. As you know, in DRC, we have this clade, the mutation of the clade 1A, Probect3, that is reported in Kinshasa. We don't want to see a lot of mutations. We already faced the mutation in 2023 with what happened in the eastern part of DRC, the clade 1B. Now we have this clade 1A mutating. We don't know what will be next. It will be important for us to have a strong mechanism that will help us to continue to improve in surveillance and in laboratory. We can see a trend, a kind of a declining trend in terms of confirmed cases. But as I say, let us take the confirmed cases with caution because the issue is mostly the testing coverage. Next slide, please. In Uganda, we see an increase in terms of deaths among confirmed cases. And that one is a major alert for us because we know the clade 1B is there. But we believe with all actions that we are conducting, including vaccination and reinforcing the surveillance system, we can manage this issue in Uganda. What is good, Uganda is testing 100% of suspected cases. And this is why we can say if we need to make a comment, we can say we are more comfortable to say this is the real trend. It's not like in other countries where the testing rate is too low. We want also to thank the government of Uganda for the transparency and the collaboration. I think now we are focusing on people who are affected because some of them who are dying have comorbidities. And it means the approach that we have to have a holistic approach, not just to target Mpox, but for all of these people with comorbidities, how can we support, how can we mitigate the risk of them dying because of these comorbidities linked to also Mpox. Next slide. And you will see it's mostly in the capital, in Tebe, where we have more cases, especially deaths. Out of Entebbe, we just have 2 deaths in Masaka, but out of the 28 deaths that we are talking about, 26 are in Entebbe. But we have also to see the success, because out of 2,164 cases, we have 2,013 discharged. It means from one side, there is an ongoing effort, but we still have some challenges, mostly for people with comorbidities, as we're discussing. Next slide, please. Uganda, DRC, and so other countries are among countries vaccinating currently. We did our best to make sure that countries, they can receive vaccines when it's needed. And I want to also congratulate our colleagues from the incident management support team, who are not only providing support at country level, but helping country to redefine the vaccination strategy. With the new vaccination strategy, we are targeting more people, we are making huge impact, and you can even see in terms of number of doses that were administered, there is a huge jump. But as I say, the main challenge we can have with vaccine, with the new vaccination strategy, is shortage of vaccine. And we'll discuss that and the way we can mitigate this shortage of vaccine. Next slide, please. This is just to show the trend in Kinshasa, the epicenter of Mpox. You'll see how we started very low, but now we are having more and more people vaccinated. We want to sustain this trend and to make sure that Kinshasa will control very quickly this outbreak. Next slide. We talk about vaccine. It means we talk also about cold chain equipment. We are supporting countries to procure. We, together with our partners, we are providing around $5.4 million to support the cold chain equipment for our member states. This is an example on what we are doing for Uganda, DRC, and Rwanda. Next slide. Let us talk about Ebola in Uganda. In addition to Mpox, as we saw, Uganda is facing the Ebola outbreak. We will see in the next slide, that will give us a more comprehensive information. Next slide, please. This is the response. But you'll see out of all cases that we had in Uganda, now we are providing with the government appropriate support in all pillars. And from last week to this week, we didn't see any new case. Because you'll see the reason is the number of experts we are sending to the country, and also how we are leveraging on the capacity of communities, like the community health workers who are well trained. And we are also providing a lot of support in what we call the field operations. It means how to investigate, to collect, and to transport samples to the lab. This is one of the key success success stories when we talk about the 100% of testing, not only for Mpox, but also for Ebola in Uganda. Next slide. Marburg in Tanzania. Yes, we are celebrating the success. It was a painful experience for the government to declare the outbreak, but we congratulate them. They did it, and today we are out of this outbreak. In total, we had 108 suspected cases, 8 were probable cases, 2 confirmed cases, but we lost these 8 probable cases, and of course the 2 confirmed cases. These are the 10 people who are officially declared dead due to Marburg outbreak in Tanzania. What Africa CDC is doing currently is to continue to strengthen the capacity of Tanzania. We provided support for the Emergency Operations Center in 3 different areas. We provided trainings, we provided IPC, and we are conducting a number of studies with Tanzania on the use of new medicines and vaccines. I think Tanzania is open today with all of the support that will prevent the next outbreak. Next slide, please. This is what I was sharing quickly with you about the support in different areas. This example, the example of the lab area, where we provided youth support, and we can also put it recorded that it's because Africa CDC provided the test kit that Tanzania had to have evidence and to declare the outbreak. We are reinforcing this capacity, as I said, and you can have a number of people trained, and how we are strengthening the capacity of different laboratories in Tanzania. Next slide. Cholera. Cholera is still affecting us. Angola was not part of the countries last year that declared the cholera outbreak, but today Angola is affected by cholera outbreak. As I was saying, Dr. Ngashi flew to Angola the past 2 days to meet together with the team, Africa CDC there, and all other partners, WHO, UNICEF, to discuss not only this outbreak, but how we can reinforce the health system. Because, you know, cholera is just the peak of the iceberg, and the whole health system must be reinforced with other determinants of health. But the good news is we see this trend, declining trend in terms of cases, 692 this week, if we compare with 958 last week. And we also see that the mortality, if we compare with what we had in February, is going down. And this is a positive message, and we hope that with the action we are conducting in Luanda and Bengo, we can stop this outbreak. But you will see, next slide, please. You will see that this effort means to have more doses. Currently, we are providing the little support that we can with our funding to Angola, but Angola will need more doses. And we will continue to work with partners, ICG and others, to see how to make sure that Angola can receive more doses of vaccine, while we are reinforcing the other pillars of the response, IPC, WASH, and others. As we say, we need a comprehensive approach to stop the Ebola, to stop the cholera outbreak in Angola. Next slide. Angola is a neighboring country of Namibia. For the first time, after almost 10 years without reporting any cholera outbreak, Namibia declared that they reported the first cholera case 2 days ago. And this one is taken seriously by Namibian authorities, and we are talking with them and Africa CDC is ready to provide support together with all other partners. And this region that is bordering Angola is explaining why we have this case, but we'll continue. And what is the good news that Namibia reported to us is the person recovered and was discharged. But it was a major alert for the country to reinforce the system and to work on the determinant of the cholera response when they can have cases. Next slide. As we said, from one side, we have so many outbreaks. From another side, we don't have enough resources. If we see the trend, each year, number of outbreaks is increasing. How can we continue to support our countries, to better support our countries, if we don't have enough resources? We are doing that on a more wise way and innovative way. Today, when I was talking with Dr. Chikwe, we're talking about the success of the IMST model that is delivering on more efficient way. And this model led for Tanzania to declare the end of the Marburg outbreak. And we are hoping that Uganda will be out of Ebola outbreak very soon, while we continue to support Angola and Namibia regarding the cholera outbreak and all other countries affected. We also see that the testing rate is a major issue, especially when we talk about Mpox. And this one is led by headcount, insecurity, and other factors that can contribute. For now, we are doing our best to decentralize the lab capacity, to support the community health workers, to support where we can with a sample collection and transportation, but we cannot do enough. We cannot do everything we want to do if we don't have security and if we don't have resources. This is our plea to our leaders to make sure that the security is in the eastern part very soon, a reality, and also to look for all ways to support the response, including the vaccine, because the Mpox vaccine, we are facing the risk of shortage. And today, without vaccine, we'll have more and more cases. This is a plea to see how, together with our partners who committed to give us vaccines, who committed to give us resources, not to stop that, because this is a major life-saving intervention. I thank all of you. Let us have opportunity during your questions to discuss a number of issues that I was sharing with you. Back to you, Margaret.
Thank you, DG. Let's take the first two questions from the chat group. We have Emery from the BBC. He asks, what is the latest on the more than 605 Mpox cases that have escaped from the treatment centers due to the conflict in Eastern DRC? And what efforts are being done to bring them back and limit the spread of the illness? That's the first question. Let's take the second one. Ben Farmer from the Telegraph in the UK asks, please, can you give us the latest update on the mystery disease outbreak in DRC and what is the cause? Over to you, DG.
Thank you so much. I will respond to the first question. IMST colleagues who are based in DRC will respond to the second one. Yes, as we reported, we have a number of cases in North Kivu and in South Kivu who left the treatment center due to the insecurity. And these people, they went in different areas, in different regions, different countries. And We are analyzing the trend in neighboring countries and is also in neighboring regions of North Kivu and South Kivu. What is the effort we are doing to bring them back? As you know, Africa CDC cannot do more if we don't have security in place. Our plea today is to see how we can support all initiatives that our leaders are taking to give us access to people, but also to give opportunity to people to come back to their regions and places that can help to provide life-saving interventions. We don't have any particular answer regarding all of these people. We are talking with different authorities to help us to understand what is going on. We hope when we have sufficient information, we'll come back to you because we know all of these cases, but we don't know where they are. Dr. Ngashi from IMST will respond to the second question, please.
Yes, thank you very much, DG. On the disease in the Equatorial region, in the health zone of Basankuso, I think there were a number of working diagnoses. I think that were being considered. There was malaria, there was intoxication. But now, after the testing has been done, it appears that on blood smears, 78% of all the tests that were done confirmed the malaria. On rapid tests, also about 56% confirmed the malaria. Now, which means now the working diagnosis is malaria. I think that's what is being treated now. And it also appears that the patients are responding very well because the case fatality rate has dropped below 1%, as you remember, from 5% at the beginning. And on the first question, also just an additional information that some of the cases have started coming back to the treatment centers. We have about 150 that have already come back. But everything hinges, as the DG said, on the return of the situation to peace, and also the humanitarian corridor that is being established, because some of the interventions that are considered in both North and South Kivu is to involve community health workers to go and retrieve all those patients that had left the treatment centers and bring them back. And I think the IMST is ready. As soon as the humanitarian corridor is established, I think the teams will deploy and go and introduce that community component that is important to retrieve those patients. Over to you, Director.
Thank you very much. Let's take the next two questions from the floor. Janice from Bloomberg, you have the floor.
Hi, sorry about the delay. You can hear me?
Yes, we can hear you.
Great, thank you. At the start of the presentation, you had a slide looking at how you've been effectively running around, speaking to different governments and looking for resources after the funding freezes, seeking support. And I was just wondering if you think that the African governments are doing enough to plug the gap. I'm very aware that often it's difficult when there aren't readily available resources to mobilize. But I know that previously you've spoken on briefings about, the efforts of Africa CDC to engage governments and to make them sort of more self-reliant. And I just wondered if you could comment on that, please. Thank you.
Thank you very much. Let's take the next one before DG comes in. Paul from The Lancet, you have the floor.
Thank you. Can you hear me?
Yes, we can hear you. Go ahead.
Yeah, so I have two questions. So on last week, we had the World Obesity Day, and one of the outcomes of the report suggested that there is a gradual trend regarding how Africa's is being presented. For instance, let me give you an instance. When we talk about crises on the continent, we still continue to talk about prioritizing malnutrition, but the continent is tending towards obesity, especially projection into the 2050s. My question is that, what is Africa's CDC doing to future-proof its priorities? We still continue to talk about infectious diseases and outbreaks, but we don't talk about NCDs as much, even though reports and trends are suggesting that this could be a major crisis for the continent in the future. Then I also have a quick question regarding the end of the Marburg virus disease outbreak. There has been a lot of emphasis around localization on the continent. So can you give us insights into what happened uniquely regarding localization of response tools and resources in the successful response to the Marburg virus disease outbreak? Thank you very much.
Thank you, Paul. DG, over to you.
Yes, thank you. I hope you can still hear me and see me, because we had a power cut. Yes, regarding what Janice want to know, we know this head cut is a difficult moment for our countries, and it came overnight, and some of them were not prepared for this major head cut. Let me remind that from 2021 to 2025, we are losing almost 70% of our ODA, official assistance that is coming from Western countries. Then, what Africa CDC is doing is a three-pillar approach. The first pillar is to say, how can we design a realistic transition plan from 2025 to 2030 that will also show the effort from African countries to increase on annual basis the budget for health, and that will send a strong message to all of our partners that Africa is taking the right direction towards self-reliance. The second pillar is about how to have more innovative financing mechanisms. And this is what we'll discuss with ministers tomorrow, because we need this innovative financing mechanism, like the airline tax that was in my manifesto. But we have also other opportunities that can help to have more funding to place solidarity of countries that cannot provide more resources to the health system, but also to complement the effort at continental level, like for Africa CDC to support the response to outbreaks. And the third pillar is what we call the blended finance mechanism. It means how to leverage concessional funds, private equity for more investment, and that can help to support agenda like local manufacturing. But all of that is to show to the partners, our partners, that Africa is taking a strong step towards ownership and self-reliance. If we don't do that, we will not be able to support the agenda of health security in the continent. For our partners who are saying, you need to support this effort also, because our health security in Africa is also your health security. And this is why this transition plan, we are selling this narrative, we are selling the effort we are doing to our partners. We are having positive conversation with a number of them. We believe that it will end up by a a specific program to support African countries based on the plans that we are now developing with our countries. This is what we can say. As we discussed during the spring meeting, we'll have opportunity to discuss that with Minister of Finance. Some of the Minister of Health will invite in Washington, and together with World Bank and IMF to find a solution on how we can better support the transition plan. Regarding the infectious disease versus NCD, you know, NCD is a pandemic today, as we have to say, a silent pandemic. Obesity linked to high blood pressure, linked to diabetes, and so other diseases. It's really a major public health issue in our continent. First, what Africa CDC did was to go deeply to each country to understand the magnitude of the issue. You cannot respond to a problem if you don't know the magnitude of the issue. And we got sufficient information from all member states. We developed the continental plan to address NCDs. We started to support countries to have appropriate plans to address NCDs by also providing, you know, appropriate domestic financing for these NCDs. Yes, we agree with you. Countries are talking about NCDs. We are talking about it. It's not an area that we are neglecting because we are just talking about infectious diseases. No, in Africa CDC, we are the public health agency and we see all of these public health issues that we have. Let me ask my colleagues to give more information about end of Marburg in Tanzania and to respond to your question. Over to you, Dr. Ngashi.
Yes, thank you very much, DG. That's a follow-up on Paul's question. I think just to also announce that Africa CDC will be releasing this year at the CPHI, the Continental Public Health Conference, the first public health intelligence report of Africa. That presents the information that you are asking about. Or it will analyze the burden of disease in Africa, looking at the maternal and child health, looking at communicable diseases, looking at non-communicable diseases today with modeling in 10 years, so that from that analysis, we then make recommendations in terms of what are the disease priorities of our public health response in Africa, and also what are the most important medical countermeasures that we need to promote, really to push for Africa in terms of diagnostics, in terms of treatment, and also what are the priority research questions that Africa need to be putting forward. I think that report will really place us in much better position as Africa. See, as we know, we are based on science, what should be the disease priorities, and of course, NCD is a chapter, you know, in that report. And then the second question you're asking about is the localization of the response, I think, following the declaration of the end of Marburg. I think what is extremely important is that that's also one of the major shifts in the response to emergencies also in Africa, learning from past experiences, that as we respond to these outbreaks, we always need to think about the legacy and the resilience of the system to make sure that the key interventions that need to continue the surveillance are actually built into a strengthened health systems, and in particular primary healthcare system. I think that's why a few things that to be left is the surveillance. I think that is critical, and most importantly, the community-based surveillance. And in line with that, we are now also linking the agenda of the head of state on the scale up of the 2 million community health workers to ensure that those community health workers play a major role in the localization of the response, in particular in the risk communication and the community engagement around these diseases, in the infection prevention and control at community level, and in the surveillance, community-based surveillance, so that we have a system that allows us to keep our people informed about these diseases, but to be also able to pick them on time with the decentralization of the laboratory, also to be able to make the diagnosis on time. And the second area that we are also working in is on the integration. As you see that we respond to an outbreak like Marburg, but at the end, we need to integrate the key interventions of Marburg into the existing system so that there's no more vertical surveillance system for Marburg. Marburg becomes integral to the surveillance system of the country. And then finally is on the area of financing as well, because you cannot localize if you also don't include those interventions into the national budget of countries. I think those are some of the areas that we're working on to ensure that these responses are fully localized for the continuation. Thank you very much. Over to you, Director.
Thank you very much. Let's take the next two questions from the floor. We have Priyanka from the Chemical and Engineering News. You have the floor.
Thanks, Margaret. My question is also related to USAID. And last week, the New York Times reported a story where they obtained an audio recording. And essentially, they said that because of the funding freeze, it was becoming harder for health workers to continue tracing contacts, conduct surveillance in the Ebola outbreak. And, they were not being able to obtain laboratory supplies, protective gear, all of that sort of stuff. Typically, we've talked about here, challenges with transporting samples, and that's where the funding was hugely impacting. So do you have any comment on this reporting? What else is being impacted? Thank you.
Thank you. Let's take the next question. Florence from Deutsche Welle, you have the floor. Florence, can you hear us?
Hey, can you hear me?
Yes, we can hear you.
Yeah, thank you very much. I'm interested to know what is the status of Tanzania Mpox outbreak. Currently, we are told that we have only 2 cases, but then there are other information which say that there is many cases of Mpox in Tanzania. But that is one. And the second question is, what is the intervention that Africa CDC is doing to help combat Mpox in Tanzania currently?
Thank you. Over to you, DG.
Thank you. I'm not so sure that I got the question. I don't know, it was from Priyanka?
Priyanka, yes.
Yeah, because the volume was too low. I don't know, Margaret, if you got it. Can you please summarize what I got? It was USAID cut, and but you can help.
I think the question, DG, yes.
Mm-hmm.
Yeah, so the question was asking about the impact of USAID cuts on some of the health interventions and other materials that are being provided to counter outbreaks. So the question was, are there any other affected areas when it comes to these cuts?
I can just add this. This was particularly related to the Ebola outbreak in Uganda.
Okay.
Okay.
No, let us say clearly, Africa is affected by the aid cut. Call it aid pause, aid frozen, but we are affected by all of that. And the clear example is when we were showing the testing rate in some countries, because money was coming from partners for sample collection, Money was coming from partners for sample transportation. We know also some partners were supporting human resources, were supporting the lab activities. We are not just talking about the US. We are saying almost all Western countries are decreasing their support. Almost all of them. And that one is a critical issue for our health security. And we are opening now the channel to discuss with our partners to bring evidence to them, but we are opening also opportunity to discuss with our leaders to say what can be done at continental level to leverage resources and mitigate the impact of this health cut. Yes, I agree with you, Priyanka, but I'm not just talking about the US cut. I'm talking about all other cuts. You know, UK 6 billion pounds head cut, even the Minister of International Development resigned. And we saw a number of other decisions from France, from Switzerland, from all other countries. I think it's a general trend. It's really unfortunate. And I don't know if this the way for Western countries to protect their health security, but I don't believe so. Regarding Tanzania, I think I shared the statistics for the ongoing, for the Marburg outbreak that we managed to stop and to declare the end of this Marburg outbreak today. Tanzania, like other countries, are facing a number of public health issues. Africa CDC, we have a number of actions we are putting in place under the leadership of the government, because we are not there to replace the government. We are there to support the government. We are building capacities of human resources. We are supporting strong surveillance mechanisms. We are bringing community health focus to be trained and capacitated to play a key role. We are supporting the laboratory sector for to test all samples that we can collect. We are supporting IPC, you know, this is a critical component of the response. We are supporting vaccination where the vaccine is available, and we are supporting the overall health system strengthening system, including the primary health care. You know, we need to understand that outbreaks in Africa is a true reflection of the health system. If the health system is not strong enough, you will be responding to outbreaks on a daily basis. But the health system is strong enough, and we have a strong component on digital agenda that can help us to quickly be informed about a specific public health issue. That will contribute to mitigate the risk of occurrence of outbreaks, even to better respond to outbreaks. Dr. Ngashi, I don't know if there is an aspect of the response I didn't bring from your IMSC perspective.
Yes, thank you very much. I think the only aspect that is left is what's the status today. The declaration of Mpox was made 3 days ago, I think on May 10th. Those 2 cases we have reported come from the official report, and they have a history of travel. That means that we are still talking about the initial case that are imported from outside of the country. We haven't yet started talking about the community transmission. But what we also know that there are other cases that are under investigation, and we'll be following that up with the country. If there's any additional confirmation, we'll update during our next week press conference. Over to you, Director.
Thank you very much. Let's take the next 2 questions. We have Dorcas from BBC. She asks, The US Secretary of State Marco Rubio announced 5,200 USAID programs have been terminated. To what extent can Africa CDC step in to fill the gap in some of the projects, including HIV, TB, malaria, and polio? The other question is from Kemo of Meno Reporters. He asks, in light of DG's appeal for vaccine, at this point, what percentage of the initial quantity of vaccines has Africa CDC received? That's the second question. Over to you, DG.
Thank you. Doctors, Africa CDC is not a donor. Yes, we start to receive on daily basis requests from countries, from partners on how Africa CDC can fund a specific program or a specific activity. But our role is not to become a donor. Our role is to be the convening power. Our role is to help our countries to have appropriate mechanisms in place, in even governance mechanisms, to provide more funding to the health system, to have efficient way to lead health programs. And our role is also to go to our partners to say, this is our effort, this is what we are doing. How can you continue to support what we are doing? And the third role is to bring some innovations on the way we are leading the public health program, even to be the bridge between public health and economic growth, job creation, like with local manufacturing. This is the overall role of Africa CDC as the public health agency. And supporting countries, we are not replacing donors and countries. Yes, we saw the official announcement of programs that were terminated. As you know, I think I mentioned that next week I'm flying to Nordic countries. Then I will be the third week of March in the US again to meet officials from State Department, to meet officials from HHS, to meet all other officials we can to discuss a number of these issues and to understand. Because I think we are learning on daily basis and we need to discuss with them to understand the extent of some decisions that are made. For now, this is what we can say. Dr. Ngashi, what is the portion of vaccines that we received so far?
Yes, thank you very much, DG. I think in the continental plan, we had requested for 10 million doses of vaccines, and we've had already 60% of that committed. That is 6 million, I think, that have been committed. And then the allocation committee has already allocated 1.4 million, and the allocations continue. But as we move into the second phase, I think we need not only to mobilize the remaining doses, but the new plan is being finalized and also identified that there are about 6.4 million people that need to be vaccinated, and we need to extend our campaign to mobilize more vaccines for the African continent. Over to you, Director.
Thank you very much. And with that, we have come to the end of the briefing this week. I'll hand it over to Dr. Kaseya to close the session for us. Over to you, DG.
Thank you so much. We started with a first slide saying that we are facing a major crisis. I think a number of questions that we got from you were related to the head cut that we are experiencing in Africa. We are saying this week, we are meeting tomorrow, our leaders. We are meeting tomorrow afternoon, all ministers of health, to listen from them. We want them to share with us the feeling they have, what they're experiencing, to discuss with them some of the solutions that I'm suggesting to you, and to see how we can together have a clear commitment on the way to move forward. Then I will be flying to Nordic countries, to the US, and to other countries to share what is the African approach and how we can move forward. We are talking now about the new era, how we can move forward and make sure that we continue to secure each other because we are living the same planet. We'll also take opportunity tomorrow to discuss about the INB process. As you know, the last meeting is in a few days, and we want to see how Africa and the other parts of the world we can speak the same language and finalize the INB process. Africa CDC is doing the best based on the mandate given to us by our head of state to see how to better support our member state for the INB process. We'll continue our effort in terms of outbreak response. We hope to celebrate more and more success in terms of end of outbreaks, but we hope also to build strong capacity and capability at country level to detect and to respond to outbreaks on more timely manner and on more efficient way. I think next week, we will come back to you with more information that we'll collect even regarding Tanzania, because this question of Mpox in Tanzania, Dr. Ngashi committed will come back to that next week. And we'll give you also an update on the discussions that we have with our partners to see how to mitigate the impact of the headcount. With that, I thank all of you and see you next week. Thank you.